I'm Kevin Cregan. I'm a radiologist. Big difference between a mammogram and an MRI. The first difference is a mammogram is an X-ray. You use X-rays to acquire it. It's a very high resolution X-ray. MRI is a totally different type of device. It doesn't use any ionizing radiation. There's no X-rays involved. It uses radio frequency waves. Basically, it's a complex process, but basically it converts radio frequency wave pulses into an image. Breast MRI is a specialized study that's reserved for only certain women who are either high risk for genetic reasons. They carry the genes that we know now cause breast cancer in a percentage of women, or who already have breast cancer and the MRI is then used to help for surgical planning. Every woman with a diagnosis of breast cancer gets a preoperative MRI because the surgeon wants to know it's just in that area, and then they can offer them breast conservation, a lumpectomy instead of a mastectomy. Now, if it's in multiple areas, they get a mastectomy, because their life depends on it. So that to me is a tool and a capability that we have not had until recently, and our surgeons have already told us has changed their approach to surgery on multiple occasions. In many ways, it's not very different from any other MRI. The only difference is that you lay on your stomach, and then the way we image the breast, we have a special, it's called a coil. It's basically in the shape of a bra. All the data from the imaging study is gathered by that coil and transmitted to the main computer that forms the images. There's no preparation. She doesn't have to fast. The entire test probably takes no more than 20 to 25 minutes. You don't read a breast MRI by itself. You have to look at the lady's mammogram and her ultrasound. Frequently, you're looking at someone who is a high-risk patient, so you want to always correlate with the other studies. Sometimes it's a problem-solving tool. There'll be something there on the mammogram that is concerning but indeterminate. The ultrasound also doesn't answer the question, so the MRI ends up being kind of having the final say as to whether that's something to be concerned about or not. Mammography is still the screening test for breast cancer. Every lady over the age of 40 should have a mammogram annually. If they don't have any risk factors for breast cancer, if they have a family history of breast cancer, then they should have their mammogram starting at 35. For those ladies who have the genetic predisposition for breast cancer, they can basically, you can save their life by detecting an early breast cancer.